Yes, I think we will start now. It's 5 o'clock. We'll start, and already we have a number of viewers on YouTube. So we should not get late. I will request, let me just say hi to everybody quickly. And now I request Dr. Anupama to start.
So, very good evening, everyone. On behalf of Oral Pathology 360, I, Dr. Anupama Mukherjee, welcome each one of you for this very special and momentous occasion, the launch of our YouTube channel, Oral Health 360, which is followed by the open mic faculty contest. Now, let me assure you, we have an interactive and informative evening lined up for all of you with some very interesting sessions in the presence of notable personalities and experts from various fields spanning dentistry and beyond. So I take this opportunity to extend a very warm welcome to our guest of honor, Dr. D.K. Daftari, also to Dr. Vinay Hazare and our chief guest for this evening, Dr. Rajiv Chub.
Thank
Now,
you.
each of them have not only shaped the field of oral health and wellness, but they have inspired countless professionals and students to dedicate their lives to the advancement of dental care. So today marks the beginning of an exciting journey, one that will hopefully bridge that patient dentist informational gap, simplifying the essence of oral health. So I It is my pleasure now to invite Dr. Mandana, the founder of Oral Pathology 360, to share her journey so far and a vision as the curator of the YouTube channel Oral Health 360.
Good evening, everyone. Thank you, Dr. Anupama, and thank you, all of you, for joining us on this very, very special occasion, the inauguration of Oral Health 360 Guided Wellness. I hope you will give me the privilege of sharing a small memory that has shaped who I am today. For most of my life, I was away from my mom, and I only got a chance to spend time with her in the last few years of her life before COVID. By then, I was already a doctor and well into my career. But it was interesting to me that every night she would wish me good night by saying, "Sleep well so you can help those who need your help tomorrow." Those words have guided me through my journey as I started Oral Pathology 360 in response to the despair our young colleagues were feeling then. They remind me that helping others is at the heart of what we do. Today, as we launch Oral Health 360, that guiding principle evolves into new dimensions, ensuring that oral health is a right, not a privilege, through education, collaboration, and awareness. Over the past 4 years, Oral Pathology 360 has been working tirelessly to democratize access to the finest education in oral pathology, oral medicine, and more recently, oral surgery. This mission has been made possible by the hundreds of experts from around the world who have so freely and generously shared their knowledge and time. Together, we have built a global platform to train and educate professionals, ensuring that patients, no matter where they are, have access to the highest standards of care. But education alone is not enough. Access to the best resources is the next vital step, and for that, collaboration is key. Through the work of Oral Pathology 360, we have built a network of knowledge sharing and expertise. Now we take this mission beyond the profession to answer the public and to empower them, bridging the gap between education and collaboration. And so, as we gather today to launch Oral Health 360, it's only fitting that we begin by honoring the visionaries who have inspired this journey. Dr. Daftari, with his call to action to reach beyond ourselves, always egging us on to do more than just talk among ourselves and to reach the patients. And Dr. Hazare, a trailblazer in using modern media to educate, empower, and to educate and empower, have shown us what is possible when we bridge the gap between professionals and the public. It's their wisdom and dedication that have laid the foundation for this moment. I'm truly thrilled to invite my colleague, Dr. Mukherjee, to introduce these inspiring leaders and share their vision with us as we begin this exciting journey together. It's up to you, Dr. Mukherjee.
Thank you,
Well,
Dr. Mandana, for sharing your journey with us. And I'm sure our diverse audience will find this channel informative, and we look forward to it going live shortly. Now, in the words of Rabindranath Tagore, you cannot cross the sea merely by standing and staring at the water. So it is the immense dedication and commitment of our mentors, teachers, and gurus who, through their hard work, have charted a path that we can now set sail on. Such has been the impact of two notable personalities of oral pathology, Dr. Daftari and Dr. Vinay Hazare. Dr. Daftari is a veteran oral pathologist, a renowned researcher, academician, and clinical practitioner. His expertise in oral pathology, oral cancer, and pre-cancer research make him a cherished mentor and sought after clinician. He is among the pioneers to explore the epidemiological aspects of oral cancer and pre-cancer in India. And his works advocate the necessity of early diagnosis and screening of oral cancer, along with the promotion of oral health. His contributions to the field have garnered national and international recognition, prestigious awards, and have inspired a generation of researchers. So it is my honor to once again welcome Dr. Daftari, and I request you, sir, to say a few words.
Well, am I audible?
Yes, yes.
yes, sir. Yes.
That was a jabardast introduction. Thank
All
you.
from the heart.
I accept it, and I'll be responding to my heart also. It's good to be on Mandana's platform. She has done wonders. And all I can say that this lovely lady has created a niche for herself by creating this platform and taken, as she rightly said, the education beyond the boundaries of the country. She has actually brought the world to India rather than India to the world. And from that point of view, her commitment and her understanding of the subject, and now involving both professionally and public at a social awareness level, is going to make wonders as the time goes by. To personally, it's honestly, she has contributed far more than many of the conference and meetings by truly providing a platform of a very high order. I salute her, I compliment her, and I congratulate her. And it's a privilege to be on her platform. And I'm happy to be here to say a few words on the oral health. See, when you use the word oral health in this country, we look both the teeth and the oral mucosa. Well, when you use the word oral health in Europe and other places, they generally look at dentistry in that sense of the word. But in India, oral health is generally considered to be inclusive of oral mucosa. In our earlier days, dentistry was, as I said before many times, dentistry was a truth, nothing but the truth, and that was the truth. Even today, the concept to some extent does remain in the eyes of the medical, in the public and medical profession, but things are changing. When you look at the teeth, you're supposed to understand that teeth are expected to last lifetime. And your general health depends upon your oral health. And since I've been given to understand that even public is in the audience, this particular address is both for the lay and learned. The baby teeth are also important for people to realize that you should not neglect the baby tooth, and anything that requires to take care of the baby tooth should be undertaken. And I've many times mentioned that if a baby or if a child gets a toothache, the whole family suffers from the toothache. But coming back to the adult teeth, all this gift of 32s are important. And in dentistry, if you're on a regular checkups or so forth, you can suddenly find that anything that goes wrong in the tooth unfolds gradually, and you've got enough time for you to handle it without going into a what do I call it, advanced dental procedures. And therefore, I always value that importance of a dental checkups and importance of a proper advices. In medical, what happens is suddenly you may get some kind of a pain and problem, and then your reports are being seen, and your report get treated primarily rather than the yourself. In dentistry, you have got everything coming in front of you, and therefore, from oral health point of view or from dental health point of view, you can really take care of your teeth in a better manner. When I use the word that you need the teeth because the digestion always happens in the mouth, it's only the subsequently the stomach and other organs take it over, but the primary digestion would always happen in the oral cavity, and that fact cannot be ignored. As a matter of fact, the more one understands the oral health, then the value of a general health would be really come to forefront. In India, where when I talk about oral mucosa and oral health, it's very important because oral cancer is a primary disease in our country. And anybody who looks at the mouth cannot afford not to look at a lesion or look at any pathology that can go into cancer. And actually, I always maintain that the dental profession is the right profession for it to undertake the, what do I call it, responsibility of understanding pre-cancer cancer and understanding the responsibility of controlling the minutes of oral cancer in this country. It's unfortunately not happening, as far as I know, in a big way. I've always been fought for dentistry because in dentistry, we study oral mucosa in our curriculum. So when you understand oral mucosa normally, then you'll be able to understand the abnormality of oral mucosa. So you are a right person responsible for it. We examine oral mucosa usually with a proper lighting otherwise. Other medical professional people might examine the oral mucosa casually. So from that angle, we are really equipped to handle this problem of oral cancer. My only thing is that the dental profession should consider privilege to understand that we have a responsibility, duty, and obligations. That particular message must go out to our profession through Mandana's channel or through channels in our teaching that we are primarily responsible. And if society respects us for our qualifications, we cannot abuse the faith in us. We are privileged to do it, and we cannot abuse the privilege by not taking care of this health, particular health situation of oral cancer, pre-cancer. Of course, there are many other diseases, but India primarily, and I mentioned earlier also that today our young generation is considered to be as a demographic dividend. But if they were fall prey to this oral pathology like cancers and other things, the same generation, instead of demographic dividend, would become a demographic disaster. So if you consider in a significant manner how important is our profession, how important it is for all of us to understand the value of our own actions. And we really have to be honest enough. You must have an ethical literacy that we owe it to the public to do something about it. We cannot ignore this serious problem of oral cancer and only talk about it. I think with these few words on the value of the teeth and oral mucosa, I'm very happy to do a formal inauguration of this beautiful channel, Oral Health 360. And I wish all of you the best of everything. And I'm sure Ms. Mandana in the forefront, holding the fort, she would see that if something seriously will keep coming out of it, and dental profession will take the reins again to take care of the oral cancer situation in country both. And I think it's good enough for me to say all these few words, and all the best to all of you. Thank you for giving me the honor, privilege, and the pleasure to be on your channel, on your platform, and to talk to this smart generation. Thank you very much. Thank you, Anupama. Thank you, Dr. Mandana. I think if there's anything else you want me to say, I
Your
can say that,
contribution.
but this is good enough. I think I've not gone beyond my time.
No,
And I hope I've not traumatized all of you with my words.
not
Yes,
at
sir,
all.
it was
Okay.
perfect.
Thank you.
These are
Thank you.
pearls of wisdom, and we are grateful that you have shared them with us.
Yeah.
And your contribution to the field of oral pathology and oral health are immeasurable. So, thank you so much.
Thank you, Dr. Mukherjee. Thank you very much.
To quote Rita Wilson, awareness is empowering. Therefore, in the process of empowering citizens with this disease free, high quality life, creating awareness is a key tenet. Now, this has remained the driving force for our other guest of honor, Dr. Vinay Hazare. By developing the self mouth mirror examination or the self me technique for early detection of oral cancer, Dr. Hazare has empowered countless public health workers to screen individuals and themselves for oral cancer. His passion for oral pathology and tireless efforts to propel tobacco cessation have garnered international recognition and accolades. His work on oral submucous fibrosis has led to the advocacy and implementation of tobacco control programs in the state of Maharashtra, where this disease is rampant. Now, unfortunately, he could not join us today for this meeting due to some unforeseen circumstances, but we acknowledge his immense contribution. As collaboration is the simple art of working together to achieve a common purpose, so as in dentistry, where multiple specialities co function to achieve the common goal of oral health for all. So I'm glad to introduce our chief guest, Dr. Rajiv Chugh, a noted endodontist and currently the national president of the Indian Dental Association, or what we commonly know as the IDA. He is also the chairman of the Pierre Fauchard Academy, the Indian section. With over 40 years of experience in endodontics, Dr. Chugh has numerous accolades to his credit and has been recognized by the Rotary, the Armed Dental Corps, and various professional organizations as well as social groups for his contribution to the profession. At the helm of two key organizations which focus on the furtherment of clinicians while addressing the need of patients, I welcome Dr. Chugh to kindly address our audience and launch our channel, Oral Health 360.
Thank you so much for the introduction, Dr. Mukherjee. Dr. Mandana, the creator and founder director of Oral Pathology 360, respected Dr. Daftari and Dr. Hazare, the stalwarts of dentistry. It's an honor to share this platform with them. I also thank the team behind this unique project, which the new channel is YouTube channel being launched, the people behind that team. I thank all of you for giving me this opportunity to come and say a few words, what I think today are very relevant in the present awareness, which is, I would say, happening in the field of oral health today. As we all know, that oral health was always an issue, especially in Indian public, which never had enough attention. But I think we'll all agree on the fact that the healthy individuals create more productive and resilient communities while imposing lower costs upon our whole health system and less burden to our providers, which are frequently overlooked and understaffed. To get there, it's imperative that we promote pathways to and models of prevention and wellness-focused approaches to systemic healthcare, inclusive of oral care, which in turn will advance health quality and build a more positive society. I wish to draw your attention to the fact that while non-communicable diseases, which cause some 74% of all deaths, are getting increased attention from global health influencers, there is one elephant in the room that has received insufficient attention to date, and that's oral diseases. That's despite the fact that oral diseases may be the most prevalent of all non-communicable diseases, affecting some 3.3 billion people today, or nearly half the world's population. While we are finally seeing the leading non-communicable diseases like diabetes, cardiovascular and respiratory diseases, cancers, and even mental health in conversation at all levels of political discourse, oral health still falls off the agenda too often. It is high time to integrate oral health into the medical curriculum and include oral systemic health and the importance of early detection and recognition of oral diseases. Millions of people have never had access to a dentist in India, so it becomes our responsibility to educate and train emergency room doctors, primary care providers, and all health professionals on the care team about the ways oral health affects our bodies systemically. An important shift in the mindset of the people occurred in 2022 when the World Health Organization adopted a global strategy on oral health. Its status report highlighted the cost of oral health neglect, noting that disadvantaged and unrepresented population are most heavily impacted. In 2023, the FDI, the World Dental Federation, which represents more than 1 million dentists and 101 national dental associations in 134 countries, presented its white paper, Access to Oral Health Through Primary Health Care, developed under the guidance of its Vision 2030 document. It's a blueprint for increasing access to care, anticipating oral health challenges that will crop up over the next decade and proposing strategies to meet these challenges. Chief among its recommendations is the integration of oral health into primary care and its inclusion into universal health coverage policies. But despite increased awareness, governmental investment in dental facilities, the dental workforce, and ensuring the affordability needed care continues to be lacking. Growing recognition, however, of the significant link between oral and systemic health is fueling action from numerous stakeholders. As I said, increasingly oral diseases are being implicated in the development of systemic diseases across the world. Such illnesses include diabetes, heart disease, stroke, and some cancers. This is alarming considering almost half of the population is reportedly affected by the oral disease. According to the World Economic Forum Global Health Equity Networks, Oral Health Affinity Group, the impacts of oral disease are reflected in lost school and work days, lower academic achievement, and diminished job prospects for adults. The global cost for treatment and productivity losses is estimated at more than $710 billion. That's a lot when studies show that preventive oral health strategies are immensely beneficial and effective at keeping costs down. Yet, oral health across the globe has gone largely ignored by both public and private sectors. Recently, history was made as over 300 member states, United Nations agencies, and non-state actor representatives attended the first ever WHO Global Oral Health meeting at Bangkok. Member states adopted the landmark Bangkok Declaration, and the declaration is more than just a document. It's a promise to transform oral health into a global health priority. It highlights the critical need to address oral diseases as part of the broader burden of non-communicable diseases, a vital step as WHO prepares for the fourth high-level meeting on non-communicable diseases in 2025. The adoption of the Bangkok Declaration at the World Health Organization Global Oral Health Meeting, which was in November 2024, is more than a moment in history. It is the realization of a lifelong mission of all oral health professionals in the world to elevate oral health to the global stage. The Bangkok Declaration solidifies oral health as a key priority in universal health coverage, ensuring millions worldwide can access the care they needed. It's a monumental step, but the work doesn't stop here. Now it's up to us to show why oral health matters on local and national levels. We are better positioned than ever to turn global commitments into tangible, long-changing action for communities. Preventive care is defined as proactive dental care and advice that helps a patient to take action to maintain a healthy mouth, protecting against tooth decay, gum diseases, and more serious issues such as tooth loss and negative impact on general health. The professional would like to see more resources devoted to providing nationwide preventive and healthcare education and a national communication campaign to tackle oral health misinformation. A platform like this you are creating today is going to make a lot of contribution in making the public aware of the importance of oral hygiene and how taking care of your oral cavity, you're taking care of your vital parts of the oral cavity can make a lot of difference into your general health. I think this is a great initiative taken by you, Dr. Mandana, and the team to bring the oral health care to the forefront for people to realize the importance of the oral health. And let's all continue to advocate, innovate, and create a future where every smile is celebrated and cared for. Together, we can build healthier communities and a healthier world. As an initiative like this is a step in the right direction, and it's time to show how better oral health can improve and benefit communities and boost economies. So I congratulate the team of Oral Pathology 360 on such an important event where you are bringing the oral health care to the forefront, making people aware, and I think this will go a long way in bringing or making people aware of your goal of highlighting the importance of oral health. And I wish you all the best in your endeavor. And I see this will grow into a global phenomena in the coming years. And my best wishes. And I am really privileged to be a part of this launch event. Thank you so much.
So you have to launch the channel.
How do I do that?
Just say you inaugurate it and I will do the launch.
It's my privilege to launch this YouTube channel, Oral Health 360.
Thank you, sir.
Thank you
Wonderful.
so much.
Thank you, Dr. Chug, for launching Oral Health 360 Guided Wellness, a channel dedicated to providing comprehensive, reliable, and up-to-date information on all things about oral health. Whether you're someone who just cares about their oral health, a student, or a dental professional, this is the place for you. So, to set the ball rolling, we would like to share one of our first videos with all of you, one that has been contributed by Dr. Vinay Hazare. Thank you for sharing that video. On behalf of Team Oral Pathology 360, I thank Dr. Daftari and Dr. Chug for your precious time and encouragement, and we look forward to your continued support. I'm also grateful to each one of you for sharing this special moment with us, and I invite you to be an active part of Oral Health 360 Guided Wellness. So for more content like this, kindly subscribe, press the bell icon on your YouTube channel, and stay updated with all the activities on Oral Health 360. I would also like to express my gratitude on behalf of the entire team to our senior faculty, our colleagues who are here with us today, along with attendees from other fraternities from around the world, including patients. Thank you for your support, including everyone who's here tuned in via YouTube. So those who are tuned in via YouTube, you can comment and interact with us, and we are eager to hear from you in our interactive session, which is Connecting Beyond the Chair. So before we move on, I request all of you to please put on your cameras so we could have a picture to commemorate this launch.
Yes, and one hello to everybody who's here. I haven't had the chance to say hi, and lovely to have all of you here, and really thank you so much. It really means a lot. Every single one of you being here means a lot, including the ones on YouTube, of course. Thank you. Thank you. Now let me click.
Yes.
Yes, we got that. Thank you so much.
Lovely.
So
with that, let's move on to our next segment. Now, coming together is the beginning, keeping together is progress, and working together is success. And with that thought in mind, let's move to our much anticipated open mic faculty contest. Now, the open mic faculty contest is a platform for sharing knowledge and expertise where your determination and your drive are your wings to fly. The interactive format allows talent, passion, and content to take center stage, while it is up to you, our audience, and our judges to decide who takes home the prize. Now, this contest isn't just a competition, it's a launch pad for rising stars, as the winner of the open mic contest stands a chance to become the rising star guest speaker at our International Oral Diseases Case Presentation Conference. So as our presenters gear up, I would like to welcome our judges for this edition of the Open Mic Faculty Contest. Our first judge is a dynamic journalist with over 3 decades of experience to his credit. He's always on the lookout to try and see from a different perspective while thinking out of the box, which has even brought him back to the books as he pursues a degree in law. I'm glad to welcome Mr. Alric Gomes. Welcome, Mr. Gomes. Our second judge for today is a product designer, entrepreneur, and former oral pathologist. His e-learning platform, Hack Dentistry, is quite the learning tool for students, with his channel supporting over 120,000 subscribers and over 2 million views. So with great pleasure, I welcome our second judge for this session, Dr. Sanket Sharad Kumar. And our final judge for this evening is you. Each one of you can vote for the presenter you found best, propelling them closer to becoming the rising star of the open mic faculty contest. Now, the theme for this edition is Bridging Knowledge, Oral Health for All. And without further ado, I hand it over to Dr. Mandana for the open mic faculty contest.
Thank you, Dr. Mukherjee. Yes, we are about to start one of the most awaited events, I guess, for the evening, the open mic. And but let me just tell all our colleagues and seniors and everyone else who's joined in, don't go anywhere. The open mic is very interesting. And after that, we are going to have a discussion that is the beyond the chair with some of our patients and with all of you. So just stay on. And with that, and of course, the link for the votes will be put into the YouTube chat in a few seconds after we start. Voting will remain open up till half an hour after the session is over. You will need to vote for every single one of the presenters, not just the one that you are tuning in for. Please try and be fair. Give everybody a chance. It's all in good humor, and it's as much for education as it is fun. And vote for everybody. Remember, you can vote only once with your email, and you have to vote for everybody at the same time. So you can open that page separately and keep on adding the grades or the rating as we go on. Now with that, we will start with the first presenter. Yes, let me ask Dr. Abhishek Badranna please to start his presentation. Everybody remember, we do have a time limit of 5 minutes.
Good evening, everybody. It's an honor that I'm presenting on this day where an important channel is being launched. So I'm Dr. Abhishek Badrana. I am a chief clinician in Adi's Dental Care. I run my oral pathology practice, Dr. Badrana's Oral Pathology, and I'm a founder director of 91 Danta Research and Product Development. So we are lucky to be incubated in IIM and MSME Hackathon. We recently cracked it, as well as we have been part of Tide 2.0 Mighty, part of the Startup Hub. So my topic was we can oral cancer. And I would request you to fill in your blanks in your minds what we can for oral cancer. Oral cancer means oral squamous cell carcinoma. Oral squamous cell carcinoma is the cancer of oral mucous membrane lining of the oral cavity. It has complex etiopathogenesis, and it's simply where the repair has gone wrong. There are some interesting definitions that has come, but one has stayed the test of time: neoplasia. The eminent British oncologist Willis R.A. in 1952 termed it as an abnormal mass of tissue, the growth of which exceeds and is uncoordinated that of normal tissues and persists in the same excessive manner after cessation of the stimuli which evoke the change. 80% of the time, the stimuli in oral cancer is tobacco. In this case, do you think this is an oral cancer? You can see Gosti destroyed 4-8 and decade 7. There's a stimuli where the patient bites on the buccal mucosa and the rough surface caused the irritation. Okay, we did extract the tooth and waited, and this went away, leaving behind a small growth where we had to remove it. The stimuli was removed, the growth went away. What are the characteristics of a neoplasia? It's progressive, it's purposeless, plants like Parthenium that grow. It's regardless of the surrounding tissue, like the drunkard who falls on the ground. It doesn't worry of the society, and not related to the needs of the body, like the jewelry on our body. And it is parasitic. It grows, takes away all the nutrition that is required for normal cells. So if you compare the first photographs here and the second one here, there is persistent growth. Okay, and the stimuli here was a tobacco in form of gutka. This, even though the patient chewed on gutka, he was lucky that there was a stimulus which were removed, and this was a simple irritational fibroma. Oral cavity is quite complex with so many things in it, especially the hard tissue and the soft tissue together. It is a portal of entry to diverse array of foreign antigenic challenges, which is transient and multiplying and active sometimes. 1 gram of plaque has 10 to the power 12 microorganisms, and only 500 species have been identified. And there is continuous chronic trauma and inflammation that's happening. So, what is the difference between oral cancer and other bodily cancer? Basically, as a common person, as a lay person, if you think of it, it is accessible. If we can't cure cancer, at least we can prevent cancer. That's what's the fill in the blank that was there in my mind. We have developed a tool on our website, which is called mymouthmyhealth.com. I'll be putting it on the chat. All of you can take an assessment over here. It looks like this, and it gives you some questions. And once you answer the question, you get your score. And if your risk factor is very high, you immediately are asked to go to a dentist, especially this oral surgeon, medicine, and pathologist. And we have also developing e-dentist, for which we have got 4 lakh rupees as a phase 1 grant, where we were trying to automate the oral examination for everybody. We are looking for investors, partners, and to prevent oral diseases, especially oral cancer. Thank you, Mandana ma'am, for this opportunity. I rest my case here. Thank you.
You're most welcome. Nice presentation. Thank you. So, right, with that, we go to the next. Our next presenter is Dr. Gauri Santakumar. Dr. Gauri, are you there? Okay, I think she's not there. Dr. Karishma?
Yes, ma'am.
Yeah. You're
Thank
ready
you,
to
ma'am.
start?
Yes, I am.
Okay, start.
Thank you, ma'am. Now, since today's open mic is oriented towards oral health and the general audience, so I don't have slides. I'm just going to talk to you in person, and I hope that I help you make some choices. So, I am a certified oral pathologist and a postdoctoral fellow at the Tokyo Dental College, Japan. Uh, my topic today would be from change to chance, bridging awareness about pre-cancer and oral health. Now, on hearing the word cancer, all of us are filled with anxiety, not just normal people, but also dentists. Yet, the awareness about oral pre-cancer amongst the general population is very low. So, what is oral pre-cancer? If scientifically you address it, it's an oral potentially malignant disorder which can present itself as a white, red, or a mixed red-white lesion. And these lesions are important because they hold potential to undergo malignant change. Now, while it is difficult to fathom how this small lesion, which is white or red, can undergo change into cancer, so it is necessary to understand that at this stage, it is the most effective if you intervene or if you subject it to some interventions. I'll go about how you do that. So, prioritizing early detection and fostering prompt treatment for precancer is a must. So, how do you go about addressing it? One, start by observing your oral cavity often. If you see that there is a change in your mucosa, then you go to a dental specialist. They will first evaluate if there is any irritational factor that is involved, such as a sharp tooth or an ill fitting prosthesis, and so on. Once this is ruled out, then they will go on to check your history if there is any involvement of implicated etiological factors such as areca nut or supari, tobacco, or alcohol. Now, yes, you heard it right, supari. So while supari is an household name, it is implicated and known as a type 1 carcinogen. So with this, the dentist will advise you some changes in your lifestyle. They may prescribe you antioxidants, supplements, lycopenes, retinoids, or other treatment modalities. Now, while some of the lesions may regress, some or majority may persist, and these are the ones that require surgical management. The management could be done by laser, scalpel, cryotherapy, or other means. Uh, Besides these regular red and white lesions, some white lesions can occur multifocally, which is they can involve more than one area of your oral cavity. In that case, newer modalities of treatment are being adopted. These include photodynamic therapy, metronomic therapy, and many others. So remember that treating pre-cancer is much cheaper than treating an advanced cancer. Continue to visit your dentist. Do not give up on your follow-up visits. With this, one cannot ignore the fact that you may encounter several challenges while you are being treated. And the most important and neglected one here is your psychological or mental health. So for this, I would recommend that you effectively communicate with your dental specialist and seek counseling for the same. An honest interaction with your dentist about your history, about your mental condition is going to aid in a better treatment and prognosis. How do you take charge of your oral health? First, as I mentioned earlier, please have regular dental checkups. Second, the earliest video that you saw on this platform about self-oral examination, that is something that each of us should adopt in our routine lives. Once you have that, you can yourself determine if there is a white, red, or any other change in your oral cavity that needs urgent attention. Next, you can quit smoking and tobacco and follow your specialist advice. Now, this is not just beneficial for your overall health, but it actively, like Professor Chub said, it actively increases your general well being and your ability to contribute to the society at large. So, I hope with this, I helped you make the choice to take that chance and change the outcome to improve your oral health. Oral pre-cancer is manageable when it's detected early. So tackle problems when they are small. Thank you.
Very nice. Thank you. And I can see oral cancer is the flavor of the evening from what list I have in front of me. And we can't help it. It's sort of so much in our mind. Okay, our next presenter is Dr. Meghna Naik with a different topic. Are you ready, Dr. Meghna? We can see your screen.
Ma'am, can you hear me?
Yeah, I can hear you. You need to go to presentation mode and start.
Ma'am, is it now open in the presentation mode?
No, it is still just a slide. You have to start the slideshow.
Ma'am, on my computer, it has started as a slideshow. Press
Okay,
stop sharing and reshare the screen.
Okay.
Doctor,
Yes.
share the entire screen. Then your presentation will also be visible. Don't share the window. Share your entire screen. There are options that you get. Share entire screen.
Yes, sir. It is already full screen that I've shared.
When you unshare it, when you share it, there is an option called share entire. Share entire screen on the first button.
Do you have two screens? Dr. Meghna, do you have two screens?
Ma'am, now? No, ma'am.
Yeah, now it's
Yes.
sharing. Okay,
Now it's
start.
okay. Yes. Sorry for the inconvenience, ma'am, everyone. Namaste, greetings to all. I'm Dr. Meghna V. Naik, an oral pathologist from Goa, India, and today I will be presenting on non-infective blisters of the mouth and of the skin. Many a times we notice a small boil or a watery fluid-filled blister either in the mouth or in the skin, and we might be perturbed to find this not only due to its appearance, but also due to the fact that it might be itchy, painful, and cause some amount of discomfort. Invariably, these might be because of infections, but in case they are not infective, like not viral infections like chickenpox or fungal infections or pre-malignancy, then they might be due to another category of lesions which are called as autoimmune blistering diseases. Autoimmune means the mechanisms of the body which defend the self get against the self proteins in the body. For example, in case of our skin and oral mucous membrane, we have an outermost layer which is called as epithelium or epidermis, which is made up of a layer or of cohesive sheet of cells which are joined together by adhesion molecules. In case of a genetic predisposition or due to exposure to drugs or due to previous viral antigens, these self proteins might be expressed by or targeted by antibodies known as autoantibodies, resulting in formation of body crypts. In these body crypts, there might be accumulation of fluids due to the presence of inflammation, and these may result in superficial blisters either outside the epithelium or outermost layer, or in between the epidermis and the connective tissue beneath the epidermis. To name, there are many diseases, mainly pemphigus and pemphigoid diseases. Among others are lichen planus, dermatitis herpetiformis, epidermolysis bullosa acquisita. All of them target different antigens or different self proteins in the body that are different adhesion molecules. To present the oral cavity, how they present is they might appear as inflamed peeling off of the gums, blisters on the undersurface, upper surface of the tongue, resulting in peeling off. Also, blistering and ulceration, since the blisters are very short-lived in the inner side of the cheeks and the lips, and sometimes they even extend onto the skin. Since 70 to 90% of the oral lesions are always seen prior to the presentation on skin, it gives the dentist a thumbs up or heads up to go ahead and stop the severity or extension of the disease, since each blister, once they rupture, forms a wound, and each wound will heal at its own pace. Some diseases, like in case of pemphigoid, might also result in a permanent scarring. In case of pemphigoid, there are blisters which are larger in size as compared to pemphigus. They form bullae and result in ulcers, and sometimes also other involvement of organs like eyes, skin, and genitals are seen. So the best thing is prompt visit to a dentist, even if the boil has ruptured, followed by keeping a good hydration and maintaining oral hygiene in the interim. A proper drug history, like history of anti-diabetic, anti-hypertensive drugs, should be told to the dentist, and involvement of other organs should also be explained. What should not be done is intentional bursting of the blister or medicating by self, and avoiding spicy foods should be done, and aerated drink during the course of the disease. When at the dentist will take a complete history and also examine whether there is detachment of the skin or peeling off. Might also take a fluid sample and make a smear on the slide and check it under the microscope. The doctor might also require to send a sample tissue to a pathologist, and advanced techniques like direct immunofluorescence can be used to determine the exact disease. Also, in the blood, patients might find some antibodies, and thus we can come to a diagnosis. Even if the disease is mild or moderate, there are medical therapies available for both cases. Appropriate referral is done by the dentist to skin specialists, ENT specialists, ophthalmologists for eye problems, also gynecologists sometimes in case of genital lesions. So the most important thing is that these lesions, may it be oral or skin lesions, might be a part of spectrum of the same disease, and the same treatment might be good for both. And hence, seeking prompt treatment may reverse or stop the spread of the disease. And we should take advantage of the advanced investigations. Here, I would like to thank Dr. Mandana for giving me this platform to present. Thank you.
Thank you for that presentation. And we go on to our next presenter, that is Dr. Srishaila H.S.
Good evening, ma'am.
Good evening. Yes, please.
Yes, hope my screen is visible, ma'am. Yes.
Yes, it is.
Yes. So, good evening, one and all. I'll be presenting on the topic delay in cancer diagnosis. All of us know cancer is a worldwide killer, and so is the oral cancer. Oral cancer actually stands as the topmost cancer among men in India. We also know that most of these cancers can be prevented. They can be screened and detected early. They can be treated in early stage if detected in early stage. So this can significantly reduce the death rate. However, most often they are detected in advanced stages, leading to poor quality of life and poor survival rate. So we can say detection in advanced stages is mostly related to delay in the diagnosis of cancer. So diagnosis and treatment delays are common in cancer. When we speak of delays in cancer, this may be because of from the patient aspects or professional or treatment related. So when we say patient delay, this is the delay from the onset of signs and symptoms to the first visit of the patient to the primary care provider. And when we speak of the professional delay, this is the delay from the first visit to the primary care provider till the final diagnosis. This can be split up as from the first visit to the primary care provider to the patient referral, from the patient referral to the consultation to a specialist, or from the consultation to the specialist to confirming the final diagnosis. So it can be like diagnostic delay, system delay, primary care, secondary care, tertiary care delay, or the referral delay. So treatment delay, it can be the delay from the final diagnosis to the initiation of the treatment. Diagnostic delays can further be divided as delay in the primary healthcare and delay in the secondary healthcare. Primary healthcare is the first contact with the general physician till the referral to the hospital, and the second is from the referral to the hospital to the final treatment. So usually the delay in primary healthcare is the longest and constitute highest percentage than the secondary healthcare delays. Total delays the time period from the first awareness of symptom to the initiation of therapy, and time to treatment initiation is from the date of diagnosis till the therapy begins, and treatment package time is the total treatment package. So this elements of the delay process consist totally of patient's professional treatment and sub delays such as referral delay, system delay, scheduling delay, diagnostic and therapy delays. Among all this, patient delays constitute the most significant contributor to the total delay, with a mean patient delay of 3.5 months in oral cancers. The current standing says that for the oral cancer delay, the most prime factor is the poor patient knowledge regarding the risk factors and the symptoms of oral cancer. From the professional aspect, it may be the delay in not referring for an investigation, or though investigated, it was misdiagnosed, or the diagnosis was not effectively communicated to the specialist, or the specialist has not acted upon early. So there can be a delay of 8 to 56 days in the professionals, a cumulative delay of 101 days, and a presence of a comorbid illness increases the professional delay greater than 1 month. So the current understanding shows that the median delay of about 48 days is expected in head and neck cancer sites and 37 days in oral cavity. So a delay between definitive diagnosis and treatment of 4 to 6 weeks seems to be acceptable from oncological or the cancer specialist perspective. So there are various factors which can be either medical factors, as we discussed now, or non-medical factors. Even the socio-economic and demographic factors such as age, gender, religion, education, family background, occupation, all this can affect the delay process. So whatever the reasons may be, the current standing shows that lack of awareness or the lack of knowledge regarding the risk factors of cancer among the public remains to be a significant contributor to the delay in the diagnosis of cancers, including oral cancer. And oral cancer, also one of the factors is the general practitioners and other healthcare providers also have little knowledge, because of which there is delay in the initial diagnosis. So mainly we can say understanding and analyzing all of these delays can help us in understanding the culprit and core of the oral cancer burden, so that we can effectively provide the remedy for each one of it. So thank you for your patient hearing, and thank you, ma'am, for the opportunity given. Thank you.
Thank you for sharing that very interesting topic. We will go on now to the next, Dr. Sujata Bayahatti.
Can see my presentation, ma'am?
Yes, it's seen. You can start.
Good evening to one and all present here, the respected judges and all the faculty members who have been the part of this presentation. Myself, Dr. Sujata Bhatti, professor from the Department of Oral Medicine and Radiology, Maratha Mandal Snataji Raoji Halgekar, Institute of Dental Sciences, Belgaum. So my topic for today is tobacco types, exploring divergent perceptions and impacts of its use on oral health. So these are the contents I'll be dealing with my entire presentation. Coming to the introduction, I would like to start with a quote given by the former President of India, Dr. APJ Abdul Kalam, who states that you cannot change your future, but you can change your habits, and surely your habits will change your future. Keeping this concept in the mind, I would like to talk about the two phases of tobacco that is giving an insight into smoking and chewing form. As we all know that India is the seventh largest and first highly populated country, comprises of 141 crore individuals in it. The beauty of our country is that we have the highest number of youths in the world. That is, 356 million youngsters are between 10 to 24 years, which constitutes more than 50% of its total population. They are the reason for the education, growth, development, and the future of our country. But unfortunately, many of them are getting habituated to one or the other form of the tobacco products, and they are starting the habit as early as 8 years. Hence, tobacco use has been linked to various oral health problems. As oral healthcare professionals, our aim is to bridge the knowledge gap about the harmful effects of tobacco on oral health. 90% of the global smokeless tobacco users are seen in India, Pakistan, Bangladesh, and Sri Lanka. India is the second largest consumer, producer, and exporter of the tobacco in the world. According to the recent Global Adult Tobacco Survey 2016-17 report, it has been noted that 53.5% of Indians are using the tobacco products and they are starting the habit as early as 8 years. Hence, smoking is killing more people each year than compared to that of AIDS. And we can see that Global Health Student Survey states 6.5% of the dental and 13.5% of the medical students are using one or the other form of the tobacco habits. The consequences led to the people who are lying next to them in the form of passive smoking is also not considered to be quite less. Hence, tobacco contributes to 56.4% of cancers in men and 44.9% in women. In India, more than 8 lakh people die and 12 million become ill as a result of tobacco use every year. We can see the consequences of the tobacco use here. So it can lead to the staining on the teeth, attrition, abrasion, and also we can see it is leading to the formation of white patches, red patches, and which has a high tendency of converting itself into malignancy at the later stage. Nearly 1,04,500 crores of economic cost of the tobacco to the government, which is found to be almost 1.16% of the GDP. Hence, dental health is considered to be one of the reasons for overall general health. Regular dental visits at the interval of 3 to 6 months for cleaning and checkup of various oral health issues, including the gum disease, tooth decay, bad breath, pre-malignant, and the oral cancer is one of the essential factors. Also, we can maintain the oral hygiene through proper brushing, flossing, and also maintaining the oral cavity with the antimicrobial mouthwashes. And also, the special oral care products which consisting of high fluoridated toothpaste and also the whitening treatments are also essential for maintaining the integrity of the color of the tooth. So healthy lifestyle choices are also play an important role, like the diet, which is rich in fruits, vegetables, and dairy products to strengthen the teeth and the gums, the proper hydration, 2 liters of water per day, which is also combat the dry mouth, which is caused because of the tobacco consumption. Also, we can see that the prevention of the gum diseases can be done by proper scaling and the root planing, as it is recommended by most of your local dentist. So the halitosis, which is also can be prevented by using a proper tongue scraper daily. So hence, screening of the oral cavity is one of the important aspects here. So the self-examination, regularly checking for white or the red patches, sores or lumps inside the mouth by self-examination or maybe with the help of the professional screening can be essential to understand the impact which is caused by the consumption of the tobacco. The lot of the data collected from our department later published in a peer-reviewed journal, and also we have applied for the number of the grants like our Rajiv Gandhi University of Health Sciences and ICMR and also Science and Engineering Research Board to understand the biomarker levels in the chewing and smoking form of the tobacco habit. There are a lot of strategies for reducing the tobacco use, which includes public health campaigns and also the dental health professionals play an important role in smoking cessation programs. Hence, we can take the personal counseling procedures or maybe the nicotine replacement therapy and behavioral interventions as a mode of quitting the habit of tobacco consumption. The lot of policy measures can also be indulged, like also can be listened. Hence, I would like to call to action I urge to all healthcare providers, educators, and policymakers to join your hands to work together in creating a comprehensive strategies to reduce the tobacco use and promote the oral health and improve the quality of the life. Hence, I would like to conclude my presentation by quitting tobacco is not a sacrifice, but it's a liberation. Thank you, ma'am. These are my
Thank you.
references.
Thank you. Okay, we go on with our next presentation. First, let me announce, in case some of our participants are noticing that Mr. Elric is no longer here on Zoom. He is one of the judges. Basically, there are no lights in his part of Goa, so he is watching the proceedings through YouTube. Don't worry, he's still there. Okay, so we go on to the next. That is Dr. Sweta Acharya. Sweta, are you there? Is she there? Yeah, you're there. Okay.
Ma'am, can I start?
Yes, please. Start.
Greetings from JSS Dental College, Mysore. Myself, Dr. Shweta Acharya, here to present or speak about metastatic deposits in the oral cavity. So, oral mets are relatively rare, but can occur in advanced malignancies. They represent a important clinical challenge. And usually oral mets can develop from various cancers which has a tendency to disseminate or spread. Various body cancers can precipitate oral mets, but the incidence of metastasis is usually less or quite low. Around 1 to 8% of which contributes to 1 to 8% of the all oral tumors. Oral metastasis can involve the jawbones or the soft tissues or both, and they contribute to around 1 to 3% of maxillofacial malignancies. The most common primary cancers which are responsible for oral mets are from lungs, kidney, breast, and gastrointestinal tract. This is a data from a latest systematic review on oral mets, which has reviewed around 950 cases all over the world, which has been recorded with maximum reports from Asia, and showing a higher prevalence in males, and common age group to be affected is between 61 to 70 years. In the oral cavity, maximum that is the hard tissue structures are frequently being affected when compared to soft tissue, wherein mandible is the favored site, followed by gingiva and the tongue. And regarding the site of the location of primary tumor, the origins are usually from lung, breast, kidney, and the liver. And usually in 30% of the cases, metastasis is an indication, oral metastasis is an indication of a disseminated disease. And the main evolution time, which has been noted to be around 3 months, and the time between the diagnosis of metastasis and the death is around and approximately around 10 months. The most usual clinical presentation is a newly developed mass or an ulcerated mass or a nodule, which is the common clinical manifestation. And the symptoms usually associated with the presentation include pain, hemorrhage, sensory alteration, mobility, fracture of the mandible, or difficulty in oral functions, out of which the most common clinical manifestation is a nodular mass, whereas the pain is the most prevalent symptom. In case of a metastasis which involves the bone, the most common radiographic finding is a radiolucent lesion. A radiolucent lesion. Coming to the histological characteristics of the metastatic lesions, these are the following types of metastasis which can be expected. That is hepatocellular carcinoma, lung adenocarcinomas, renal cell carcinoma, as well as breast adenocarcinomas, clear cell carcinomas, or the adenocarcinomas of these organs are the frequently ones which metastasize to the oral cavity. The route of metastasis is thought to be as hematogenous, where oral tissues provide a favorable site for the secondary growth. Basically, the diagnosis usually involves the clinical evaluation, the imaging, which involves the CT scan and the MRI, which helps in differentiating the primary oral cancer from the metastatic lesion. Apart from that, the biopsy, which is the basis for histopathological examination, which helps in the identification of the cancer cell as well as the origin of the metastatic lesion. Apart from IHC and molecular profiling can help in differentiating the primary tumor and the metastatic lesion. The prognosis of a metastatic lesion, whenever there is a presence of metastasis, obviously the patient moves into an advanced cancer stage, which indicates a poorer prognosis. Metastasis usually signifies that the tumor has spread beyond the confines of the primary site, basically indicating an aggressive clinical course, and there is a limited curative treatment which can be done. So basically, management of such patients are complex and it requires a multidisciplinary approach. Though there are various modalities of treatment like surgical resection, radiation therapy, or chemotherapy, most of them, since they are in the advanced stage, it is the palliative treatment in the form of relieving the symptoms, improving the quality of life, controlling the progression of the lesion rather than aiming at the cure of the disease process. Basically, the take-home message is that since it will be clinically challenging to know the primary as well as the metastatic lesion, especially to the pathologist as well as the clinician. Dentists play a crucial role in diagnosing such lesions, and they might aid in diagnosing the hidden primary metastatic lesion or the primary metastatic tumor. So please do not neglect any oral lesions. They can be deceptive. Thank you, ma'am.
Thank you. Thank you for the presentation.
Yeah.
And with that, we go on with our next,
Please,
Dr. Sayeda Arshiara.
Yes, ma'am. I'm sharing.
Yeah.
A very good evening to one and all present over here, respected dignitaries, the judges, and all the YouTube watchers. I am Professor Dr. Sayeda Ashiara from Albada Dental College and Hospital. I am here before you to present the awareness talk on tobacco addiction with the theme Using Tobacco is Not Brave, It Can Lead You to Grave. With the help of tobacco cessation specialists and the Centers Towards a Tobacco-Free Generation, action, awareness, and empowering change. The objective of my talk is to sensitize and make aware of the alarming effects of the tobacco on the general and oral health, highlight the best evidence-based approach towards cessation. Let me give you the information that there is an entry of 5,500 individuals, that is 20 lakhs per year, into this addiction balloon, and there is an exit of 3,700 individuals every day with 13.5 lakhs per year. This means that very few addicted individuals are surviving. And these are the various smoke form of the tobacco. The alarming fact is that the temperatures in the burning cigarette ranges between 400 degrees centigrade, and between puffs it is around 900 degrees centigrade. Imagine the level of high temperature as compared to your normal skin temperature, which is just 37 degrees centigrade. Now, this is a cigarette which contains various ingredients like lead, tar, cadmium, butane, and all these ingredients are also present in several articles. Imagine the lethal and the poisonous nature of this particular cigarette. And research reports that there are 7,000 chemicals and 70 carcinogens in the smoke form of tobacco. And in the smokeless form of the tobacco, there are 3,000 chemicals and 30 identified carcinogens. Now, after having known, let us also get the information that why it makes addictive. It is all because of the presence of nicotine, which causes the release of dopamine in the brain, because of this, people will have a good feeling, and there begins the crave. And also ABC linking of the addiction with your behavioral clues, and one smoker trains the other smoker to join, and also because of the socio-cultural aspect of the people around you. And let us have some information about the menthol also, which has a very soothing effect and doesn't cause any respiratory discomfort, which means it makes smoking more tolerable. And it also reacts with nicotine, which contributes to the cell damage or death. And this is all the glimpse of the hazards that affect an individual from head to toe, beginning from your CNS system to your reduced fertility and all others areas of the body. And it is said reports also suggest that lifelong tobacco users loses at least 10 years of life on average with every puff of cigarettes. And the smokers are also up to 22 times more likely to develop lung cancer in their lifetime as compared to the non-smokers. Now, let us also know what exactly the second-hand smoking means. It is nothing but the smoke which comes out from the soldering cigarette that an individual, especially the children, inhale it, and this also reacts with the household articles and transforms into a third-hand smoking, that is your walls, doors, carpets, and clothes. And it has been research tells that this third-hand smoking is genotoxic and also carcinogenic. Now, these are all the glimpses of the addicted heart, the intestine, and the lungs of an individual, and all the oral manifestations of these precancerous lesions. If all these precancerous potential malignant lesions are not addressed, they might progress into something called as an oral cancer. Now, having known all this alarming effect, you should know who are the best people who will help you in treatment assessment and also give you a quality of life. They are none other than the certified tobacco cessation specialist, who are the who motivates you, who works as an quit buddy, and also as tobacco marshals and tobacco ambassadors. They also do a lot of community sensitization programs, either offline or through a digital platform. And also they engage the community by organizing certain road shows, street plays, and even these oral health screening camps. And they take even pledge from the community workers also. They build a cessation system. They help you understand why quitting is hard. They do the brief counseling through a 5-way approach. They assess your stage of change. They assess your nicotine dependence, and they explain you what are the roadblocks, what prevents you from stopping your habit. After having assessing all this, they treat you by an holistic model of ABCD approach. That is something called as active motivation, behavioral therapy, comorbid management, and using drugs and medications. Now, there are several e-cessation apps also available where you can monitor these patients, their habits, record all their findings, and assess them what level they are dependent, and guide them to e-pharmacy also. And even they run the tobacco wellness program. And these are all the glimpses of the pharmacotherapy that they use to manage the patient, these kind of patients. They even manage your withdrawal symptoms as well as your comorbid conditions. So through all these activities of multifaceted approach, these are the glimpses how these specialists work at different areas at individual level as well as through the community platforms. And all these activities, the effectiveness of these kind of cessation programs shows that this trend, there is a 70% of increase in a quit rate by 12-month period. To conclude, I would like to give a takeaway message that by combining all these activities into a cohesive program, every department in a dental college and hospital can establish a comprehensive and an impactful tobacco cessation initiative. If you are addicted, seek your certified tobacco cessation specialist who treats you holistically to give you the quality of life. Thank you. Thank you, one and all.
Thank you for that presentation. And with that, we go on to our next presenter, Dr. Tonya Raut. Are you there? Yeah, okay.
Is it shared, ma'am?
Yeah, it is. You can start.
Recently, I had a chat with one of my relatives regarding me joining dental school. Surprisingly, he was convinced that dentistry is just about removing a teeth. That day, I realized not just me, but my subject is also struggling, and I need to work a lot for public awareness in terms of oral health and dental health. Good evening. This is Dr. Tonya Raut, practicing oral pathologist at BP Koirala Institute of Health Sciences, Dharan, Nepal. Thank you, Dr. Mandana ma'am and Oral Pathology 360 for this wonderful opportunity. Let's talk on to oral health. Oral health encompasses an ability of an individual to eat, to speak, to smile that gives a sense of well-being and self-confidence in the society. Any deviation from this state would be probably because of some sort of oral diseases, can be a dental caries, edentulism, oral cancer, or some sort of birth defect. So why do we need to care about this? Because 3.5 billion population, which approximate to 50% of the world population, has one or other form of oral diseases. The global burden created by oral diseases has surpassed the global burden created by a combined 5 next non-communicable disease of the world. And that's why probably the entire world has come up with a single slogan of oral health to all. That's a global picture. Let's see some of the data from my country, Nepal. The most prevalent oral diseases are dental caries, periodontal disease, and oral cancer. And this data resonate globally with highest case load from India and China, probably because of the population size. All these oral diseases has created a major financial burden. If you see the global expenditure onto the oral health management, it is around 400 billion US dollar, and USA is the highest investor for this. For Nepal, it is around 89 million US dollar. Despite of this huge investment, the research says 9 out of 10 individuals from an economically sound country like USA does have a dental caries, and the picture has not been changed in past 20 years. So what can be done? Should we increase our financial investment? No, I guess we need to promote our preventive measures. Government has tried with toothpaste fluoridation, oral health insurance, but they are not enough. Government has also tried with pictorial health warning onto the packages of tobacco and its product, but still the level of awareness is below what we have expected. It's time for us to change our approach now. Nowadays, we see so much of young professionals utilizing these reels and videos to promote themselves. Let's use this media because this would be a very important tool for mass awareness. Even at professional level, we can use this patient-doctor interactive session to update and educate our patient onto preventive health so that we can reduce the occurrence of oral diseases. Apart from that, we can educate our upcoming young professional about essence of interdisciplinary, multidisciplinary approach. We can try with case discussion. Let's try with referrals. Let's try with interprofessional interactive session. We need to listen to our patient. We need to talk to our patient. And that is how we can create an awareness that oral health has a major impact onto the overall health. And hence, it needs to be addressed as a whole. We need to remember that we are a branch of a same tree that was grown to promote the health of a mankind, and oral health is nothing apart from a overall health. We were branched not for the precision, but we were branched for the precision, not for the division. I'm an oral pathologist by profession, but I do sometimes pen down for awareness onto oral health, and these are my articles. These are my references. Hopefully, when I meet my relative again, I would be able to convince him that dentistry is much, much beyond than just removing a teeth. Thank you. Thank you, ma'am.
Dr. Vandana, you would have to unmute yourself, please.
Yes, I realized. Yeah, thank you for that presentation, Dr. Raut. I do wish you success in that. And it's something we all try, yes. So next is Dr. Vivek Gupta, our last presentation, before we move on to the next section. Hi, Dr. Vivek, please start.
Sorry for a delay, ma'am.
No problem. Okay.
Good evening, everyone. Today I will be discussing about research promotions in oral health, significance and benefits for the public. I made this presentation just keeping in mind the general public. And the term research relates to clinical trials and medical trials and all type of researches. Now, what is research? Research is a systematic investigation aimed to discover new knowledge or to understand prior existing scientific information in a better way. Now, who can conduct oral health researches? He can be any of these dental research professional or an academician in dental institutes or dental PG students who all we know that who conduct research as a part of their curriculum. Now, why the public should volunteer for oral health research? Once enrolled in the research, new advanced therapies and treatments still not available to the public yet can be accessed at very low or free of cost, thus helping one to enhance personal health as per their requirement. As we all know that any type of investment, the investment that is best is considered that what you invest in your health. And to the participants or the volunteers, that by volunteering, they also help science. By volunteering in research, one can help researchers to gather valuable data for their study that can lead to new discoveries and advancements in oral health. The volunteers can also make a community impact. By promoting or volunteering in oral health programs, they can benefit the entire community in respect to overall health of the peoples. And by volunteering, one can indirectly help improve public health policies that are made by the government. Along with all these, an additional advantage of gaining educational experience is also there. Participating in research can be a learning experience, helping one understand more about oral health and several other scientific processes related to research. Now, for the volunteers, how to know about the ongoing researches that they can do by staying informed. Stay informed about the latest research findings and ongoing community oral health programs in the nearby hospitals and in the nearby dental institutions. The other options to approach research participation is through the miscellaneous online platforms like Facebook, YouTube, LinkedIn, as they provide research volunteers form for the participants. They can also go to online dental journals, research publications, and research databases of medical and dental institutions. Now, apart from these, there are some monetary benefits for the research volunteers also. As we know that some research studies offer financial incentives or compensation for participants to the volunteers who take part in the research. They also get access to new treatments, as participants may gain early access to new treatments and therapies that are not yet widely available. They can save money with that. Health improvements. Participating in research can lead to better personal health outcomes, reducing long-term healthcare costs. In the last, the conclusion is from my side that everyone's participation is essential for advancing research and improving oral health. So I urge everyone to support research projects to achieve excellence in oral health for all. Thank you.
Thank you for that presentation. And with that, we wrap up the... Yes, let me turn off this timer. With that, we wrap up the open mic section. And to tell everyone again, the voting will be open for still another half an hour maximum. After that, the voting portal will be closed. And the results will be announced on Monday. So you stay in touch with us and stay tuned into our channels. You will find out who is winning this on Monday. In the meanwhile, now I will just hand over to Dr. Anupama to start with the next section. Sorry, 1 minute. Where is Dr. Sanket?
He's here.
Yeah, can you put on yes? We have lost Mr. Alaric because he's on YouTube, so obviously he will have to type his comments. But Sanket, where are you? Can you put on your...
Oh, yes, I'm here, ma'am.
He's
Oh,
there.
yes, good. Okay. So, just for everybody's opinion, information, Dr. Sanket runs a very, very successful educational platform where he reaches students very well. He makes the toughest concepts very easy for students to understand. And I mean that as in our undergraduate students. So he has a good idea of how to connect with people who may still not be that advanced in the professional side. So that I think also applies with reaching the public. So I'd really like him. He was one of our judges today. I would like him to tell us what he thinks as our first attempt so far to reach the public.
Thank you so much, ma'am, for inviting me. First of all, congratulations on the inauguration. Oral Health 360. My best wishes to you and your team, ma'am. It's been a wonderful event so far. And this is a nice initiative. I think this open mic topic is sort of a good opening for the Oral Health 360. And I did see, it definitely takes a lot of courage for someone to, talk to an audience. And I think all our doctors here today have done a fabulous job. So as that, man.
Good. So essentially you find the first attempt good. So that's nice to hear. Yes. I see everything through slightly tinted rose glasses, so tinted glasses. So I thought I will ask someone else for a more unbiased opinion. So thank you so much. Okay, now I will hand over to Dr. Anupama so we can go on.
Thank you. Thank you also to all our participants for sharing your work, our judges and our audience for their patient listening. Once again, let me remind you that please vote for each contestant and then submit your forms towards the final result. So while everybody is, making the decision, I request all the participants, judges, everyone who's here to please turn on their camera. Let's do a picture.
Yes, this is the post open mic picture. I know we did one earlier, but we'll just do one more. And hi, Geronimo. Thank you. Yes.
Lovely.
Hello. Yes, we shall do this now. Got it. Thank you so much.
Thank you, everyone.
Yes.
So let's move to our next segment, which is also a very awaited segment. We're looking at connecting beyond the chair. So this is all about interaction. So we've made it an interactive session where we can express our views, we can share our concerns, we can sound out ideas to make oral health simpler and also to make it less intimidating, because time and again people seem to be very frightened, very apprehensive when we talk about oral health, dentistry. So in an attempt to make it better received by one and all, we have this session which is connecting beyond the chair. So for all of you who are joining us on the Oral Health 360 channel on YouTube, I request you to please type your comments, your questions, share them with us so that it can be interactive on all platforms. The theme for this session is a message you would share with patients and or dentists. So this is open to everybody. It's not just restrictive to people who are practicing dentistry, oral pathology, or any of the specialities. It's predominantly open to everyone who is here. We would love to hear how could this have been better for you as an experience at a dental clinic, at, say, a camp, and what can we do to make it better? So over to you, Dr. Mandana.
Yes, thank you. So this channel and this is really about the people we serve. So it is, I will not say only patients, because there could be a healthy person out there and who should also be included, but it is about the public. We have a professional channel all for ourselves as Oral Pathology 360. So this is about our public. And with that, I would like to really reach out. So the first few people we are going to talk to are going to be the non-dentists amongst us. And then after that, we will hand over and we will move on with the dentists amongst us. So, but first we have a recording from a very good friend of mine who has sent this. And Miss Anjali Mulati, so she has sent the one thing, rather two things she would like to share with dentists. Let's listen to that and then we continue.
So I have a couple of messages as a patient to the dentist community. One, when a patient comes to you, do check on their current oral health practices and suggest any modifications or steps they could take to maintain good oral health. And the second is, if a patient comes to you for one issue, say a root canal, then do a proactive check on other possible problems or something that looks like potentially going to cause issues, and correct it at that stage itself. I've not had these kind of experiences with dentists, and I feel that would help. Thank you.
Yes, thanks to Ms. Mulati for sending that. From that, I'm going to request, I did see Dr. Mehrotra with us. So, sir, are you there? And can you put on your camera? Yes, good evening, sir. How are you?
Hi, good evening, Dr. Manna and groups. I've been very well. Thank you so much. It's a pleasure to be with you.
Thank you so much.
As always, I was so happy to see my senior colleague, Dr. Daftri, along with others who have spoken. And I enjoyed the open mic, very wide variety of topics, some obviously relevant not only to folks in dentistry, but also outside dentistry, as you mentioned. So it's a pleasure to be here, and I congratulate you and your team for coming up with this new patient-centric and colleague-centric platform.
Thank you, sir. So, sir, for everyone who does not know you, Dr. Mehrotra is a pathologist, so not a dentist, but as a pathologist, he still has the exception of working a lot with dentists, because he does a lot of work on oral cancer. Amongst the many cancers he works on, but one of those is oral cancer. So he is in that interesting spot in between being a dentist and not being a dentist. But so I'm going to ask you, sir, what would be the one thing that you would like to tell the rest of us, dentists, in general?
Well, I think, as was mentioned by many of your colleagues who spoke today, oral health is the gateway to your gut health. I know a lot of influencers and YouTube folks are talking a lot about oral health, some rightly, some wrongly. But unfortunately, and I don't mean in a very negative sense, I mean in a real practical sense, the oral cavity is among the most used and abused. So the kind of stuff that we consume in our day-to-day life in this country is so varied, and some rather toxic too, that folks researchers and clinicians who study the oral microbiome, and as you know, that could be something very pertinent to a development of oral diseases, not only benign, but also malignant and potentially malignant diseases, are at the wit's end. As how do you study the oral microbiome in India when we use it and misuse it so much? So starting from not only rest of the world, when you talk about tobacco, and I know there was a very interesting cessation topic by Dr. Saida just a moment ago, we also chew tobacco. And I'm sure many of your listeners also know that in addition to chewing tobacco in various forms, keeping it in various parts of the oral cavity, in the part of northeast of India, we actually drink tobacco too. So, of those you may not be aware of, those who belong to the Northeast, I'm sure you are talking about Tuibur, which is in 2 states of Northeast of the country. It is a traditional drink, just like you offer coffee or tea. Here you order and you offer Tuibur, which is basically tobacco smoke infused liquid, basically water. And if you do not accept, and if you say no to drinking the welcome drink, so to say, it may be considered quite an offense, and you may be barred from that household for the rest of your life. Interestingly, when a new bride comes to the home, just like in North India, and I'm sure in many other parts of the country, the bride is supposed to be making a sweet dish or one particular dish for the rest of the family. If the bride cannot make a good tuibur concoction, she may well be destroyed for the rest of her married life in that household. It's a very interesting, I'm sure it is not the rule, but it definitely does happen. So as far as your listeners are concerned, my my suggestion is that keep learning, keep being hungry for knowledge, and keep being foolish. I know folks here, some of them have started their own channels, which is very good, not only for students of dentistry, but also for the general public, because we've been talking about oral cancer awareness, oral health awareness for so long, but just like I joke quite often, we don't even see any of my dental colleagues until our teeth are practically falling apart, either in pain or they're bleeding or something that's practically prevents anybody from sleeping. So with that state of preparedness and that state of preventive care that we have, I think you have a very, very hard road, which I'm sure all of you are familiar. It's going to be a hard job, but it is social media, especially regarding, the channel like you are inaugurating today of Oral Health 360, just like your Oral Pathology channel, I think is going to be a game changer. And the only way to do it is to keep plugging on and hoping for the best.
Yes, that's true.
Thank you.
Thank you, sir. Thank you so much. Very good information and some very good advice too.
And I also see my friend Joss Hill from South Africa, from Cape Town. Dr. Joss and myself have been working together for the last about couple of decades now. And he's a strong believer in oral health awareness as well as oral pathology. I think he's one of the champions around the world. He also worked with me in the WHO head and neck fascicle. And I would also like your reviewers, sorry to take a moment more. There is an oral cancer prevention handbook which has been released by the WHO IARC in the last 6 months or last year, and it is available freely on the IARC website. Please have a look at it. There's some very good evidence-backed information there, which might be proving useful, especially as far as India is concerned and the neighboring countries, developing countries. Thank you so much.
Thank you, sir. Yes, the IARC book is always a great book. And yes, of course, that as you will see today amongst us in the on Zoom are some very close friends and close supporters of Oral Pathology 360 who have been kind enough to join us here. A number of others are, of course, as usual for us on YouTube. So going on, there's Mr. Richard. Richie, are you there? I did see you a moment back.
I am here. Thanks for
You
having
are
me.
there.
Yes. I have a question. I was wondering who or how anybody is utilizing AI these days, or if you have plans to. Like, what's AI? What part is AI taking place in everyone's work these days?
Okay, right. So it's a good point now to flex back to the doctors. Anyone who would want to answer that?
Yeah,
Yes, Manna, I think I can take up the first one.
Okay.
If you don't mind. Richard, I think that's an excellent question and something very pertinent. Way we have worked as far as AI is concerned, that, when we talked about oral cancer and oral pre-cancer, the All India Institute of Medical Sciences in Delhi, under our ICMR project, has started a program under the MIDAS, which is the Medical Image Registry, which is annotated images from oral potentially malignant as well as malignant diseases, which have been annotated. And that has started for the last about 2 to 3 years now, along with the Indian Institute of Science. And one of the reasons why we did that was to not only provide a repository for images, which are well documented and very well curated, but also explore the use of AI ML. So the first thing that they have done is they come up with a prioritization app, which is available, I think commercially is going to be available very shortly. They have tied up with a startup, with a commercial partner, and that is going to be there. You can take an image, transmit it directly, and that is going to be, that's the clinical image, and that is also going to be judged by a real human being, but also at the same time that will be used for training AI as a triage tool. The other area that we, along with my colleagues, have been working on is looking at possible to, this is again in development, it's too early to be announcing this, to look at histological images of oral potentially malignant diseases to see whether they can actually, just by looking, one look at a low power microscope, say it's normal or abnormal. And when if it is abnormal, the idea is to train it to be able to at least give a presumptive diagnosis. And we can, and that's the reason why we are focusing more on oral potentially malignant rather than full-fledged squamous cell carcinoma. So this is something that is already there in the real world, but we are hoping to improve it as we go along. Thank you.
Thank you, sir. Yeah, Dr. Abhishek, you have raised your hand. You want to say something?
Yeah, Dr. Richard, thanks for the question. So I have just posted one link on the chat about BerryCare. They're already there. It's an app that is working on AI/ML, and it says that 80% risk of cancer, 60% risk of cancer. These guys are called Atom 360, and they're doing a lot of great work in this field. And I have 91 Danta Research and Product Development. We are actually tying with them and trying to develop this not only for oral potentially malignant disorders, but also oral health, where we want to make it intuitive based on the habits as well as the oral hygiene habits as well as the other habits, and then the present situation, and then give a report to the patient, an intuitive report that if you don't do this in the next 1 or 2 years, there are going to be changes that's going to be seen. So a lot of things are happening, and it's a space where a lot of grants are available. And India is also working a lot on those things. Thank you so much.
Yeah, thank you. I think I'll just wrap up, Richard, and just to give everybody some context. Sir Richard Wilmore, you might have seen him if you attended our conference. He is our associate, and he helps us in conducting the conference in the night hours when sort of we sign off. He is the one who takes care of everything running. So I think what I would like to add here, and anyone can feel free to correct me, is that there is a lot happening on AI, whether it is for cancer detection, for prognosis, or also within general dentistry, where we can even right from assessing cavities to everything else. There is work going on how we can use the power of AI to improve our diagnosis, make it more faster, or rather reduce the margin or the time that it takes for something to be identified by us, and also on how to manage it, how to streamline things. But for the most part, all of this is still in the experimental and the development stage. There is still very little that is actually being used. In fact, I have personally not so far come across anything that is right now in 100% clinical use. So, but we are hopeful, we are looking forward, and we should hopefully get there. Now, let's see who else is with us, and let's ask for someone else's comment. So
we have,
yeah,
yes,
yeah.
So let's go ahead with Dr. Geronimo.
Yeah, Dr. Geronimo, all the way from Argentina.
Hi.
And he is an oral medicine specialist, so he regularly interacts with patients. Let's see what he has to say from his half of the world.
About AI or about healthcare, Mandana, just to be clear?
No, about what would be the one message or one thing you would like to tell patients?
Well, it's the same problem that it was when I began studying dentistry. That is that our specialty, oral medicine, oral pathology, is not known not only for the general people, for the general population, but for most of the medical community, keeps being a serious barrier in order to get us or get the healthcare of our patients to be improved. We keep talking about oral cancer risk factors, and it is a fact that we have improved, let's say, a lot in understanding the disease, but we still haven't improved in a real impactful manner the prevention of oral cancer. Because let me give you just two quick examples. When we are talking about risk factor for oral cancer, as we have this morning, the conversation usually goes around tobacco and alcohol consumption, but there are a lot of patients who smoke and drink alcohol that doesn't have cancer, and on the other hand, you have a lot of patients who have cancer and doesn't have that factor. So there are still a lot of things of this serious disease that we don't understand. We just don't know, and we have to keep going, looking in other ways, because obviously we need to do something different and we need to improve. The second one, oral potentially malignant disorders. Do any of us really know how many oral squamous cell carcinoma actually came from OPMDs? Most oral cancer prevention programs are focused on OPMDs, but we don't know how many cancers comes from that, and maybe the cancer that doesn't come from at least known OPMDs should be approached in a different way. We don't know that. So I think we need to do a change, and the change has to begin with us changing our attitude, because the way I was teaching, the way I was taught my specialty, clearly I have to say it doesn't work. We have to change. We have to improve. That's all. So.
Very correct. Very true. I also have to say, I think for the last 30 years, what we have read and what we have found in oral cancer has not really changed. We have understood it better, yes, but the danger, the numbers have not really changed that much. And take a snapshot of this evening's talks. The majority were about oral cancer. And the same thing happens in every one of our meetings and conferences. We spend more time on oral cancer than we do on anything else. And yet we are making very little progress. And that's sad. That's very sad. We do need to change something. I don't know what, but something. And on that note,
I would also like to add to that,
please.
That like it's been highlighted that yes, a lot of people don't know that these specialties exist. What are the sort of services that we can extend to them? I think a lot of people also find it intimidating when they hear it. So on that note, I would want to probably have Mr. Soumya Banerjee. Are you there?
Yeah, can you hear me?
Yes. So we have Mr. Banerjee with us. He has been at the helm of InfiBeam and various other organizations, but also outstandingly, he is a mentor and also a volunteer, along with an advisor to various NGOs and nonprofit groups. So could you share maybe what has been your experience about oral health, dental care or anything that can be improved and we can make it better?
Yeah, hi. Firstly, sorry for keeping my video off. I'm in a rural area, so bear with me. So I'm not a dentist nor a doctor. I go to one, and I'm blessed to have a very, very good dentist. So that is the first part. I actually volunteer with an organization called Can Kids. We work with children with cancer, and two aspects to it, right? We work with around 141 centers across India with different hospitals and governments. And a couple of observations. One is they are given training, not just how to wash your hands, how to keep yourself sanitized and clean, but also in dental hygiene. So that's at the base level. I know that we are doing it. That is the first part. The second part, I think India, given the size of the country and just the vast populace, it's hard to do anything without the government, really. Kind of, we want to do it, but it's hard to do anything without the. We work with ASHA workers or kind of the primary healthcare workers at the ground level. So that may be one thing, which is to sensitize. And it takes a lot of work to get in bed with the government, but to actually push out the message at the ground level, because we'll see the kid come in with cancer, but here the father is chewing tobacco. And what do you tell him, right? So my one thing just from practical observation is, how do we push out the message at the ground level to the villages, to the small towns? I think that is very, 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 very important. So awareness, I think, is the biggest game out there, because people just look at that sign and they're okay, theek hai, I'll just continue chewing. So what I would say is spread awareness from a layman's point of view, but spread awareness at the village and at the small town level. That's very, 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 very important, because that's where the bulk is, I would say. That's kind of my 2 cents plus GST.
Thank you. Thank you for sharing that. It is a big mission, and I think we are all moving in that direction to spread awareness, to raise awareness at the grassroots level. Thank you so much.
Yes, thank you so much for that. It's very helpful when we have people who are actually, out at that level, getting back to us and telling us what is reaching and what is working, or whether nothing is working. Even that's important to know, because otherwise we are, like we are working in vacuum. It's separated. There's a disconnect between what happens and what efforts we make, and or basically the profession makes in trying to reach the public, and what actually happens with the public. So that was very helpful. Thank you so much for joining us. And yes, Dr. Anupama, anyone else?
We have Dr. Bhuvan with us.
We have Dr.
I think Dr. Bhuvan would like to share some points.
Right. And then we will
Yeah,
have Dr. Hila.
hi, good evening. Yeah, good evening, Dr. Anupama. Good evening, Vandana ma'am. First of all, many congratulations for the new your new venture, Oral Health 360. Sorry, I am not able to put on my camera because I am traveling. Hope my voice is reaching everybody. And it was indeed a very nice program. All the presentations were very good. And I want to give my message both for a journalist and the public. For the public, I want to say that your mouth reflects your health. The oral cavity is a mirror of your overall well-being, and you need to go to your nearby oral healthcare physician or a dentist for routine dental checkups. And he should see any kind of signs, or even if the patient, because we have talked a lot about oral cancer, so the kind of the self-examination technique, if you find any kind of ulcers or patches or any redness, so please take care of that. And very old saying, prevention is better than cure. So take charge of your health by maintaining good oral hygiene, avoid harmful habits like tobacco and alcohol, and visit your dentist regularly. And now, one more thing which I wanted to tell, that your partners in health, dentists are not only trained to just for the teeth, but they are medically trained people who can even see the kind of oral manifestations which can be because of any kind of systemic illness. So, and yes, biopsy, I would like to highlight to the general dentist people that please look beyond teeth and gums. It is not only just teeth and gums, even the oral mucosa is important. And as dentists, our role is beyond addressing oral hygiene, because mouth is the gateway for detecting systemic health issues, and examine thoroughly for the signs of systemic diseases, including oral cancer and other medical diseases. And biopsy is very much important. So treat the patient as a whole, not just their teeth and gums. Remember, your comprehensive care can make a life-saving difference. So together as a oral health community, let's work together for bringing a change and a healthier community. Thank you so much, ma'am, for giving me the opportunity to speak, and many, many congratulations and my best wishes for Oral Pathology 360 and Oral Health 360 channel. Thank you.
Thank you, dear Bhuvan. I know your good wishes are always with us. Thank you so much. And before we wrap up, let me speak. Professor Hilla, you are there. I know you're there, but I can't see you for some reason. Ah, there you are. Yes. So I'm waiting to hear from you. What would you like to say to the patients?
Good evening, everybody.
Oh no, we lost it.
For at the moment, but not driving. So can you hear me?
Yes. Yes.
The car, not driving, so don't worry.
Okay, I was wondering why you were
good e-
having a seat belt and plants behind you. Okay, that was confusing.
Yeah, that's controversial, I know, but that's the only background I can find. Good evening, everybody. It's a pleasure, really, once again, to be part of this session, and I really admire the zest and the enthusiasm that exists in your environment and your continent, and I congratulate you for this. We know that in Africa, the circumstances are very different, and we have much less of you, and also about the same number of potential patients. So that is one thing I always say, that we lack the resources to really implement what you in India can actually do with the numbers you have and the infrastructure. That's just one comment. But we learn and we look at you, so don't worry about it. We will try to do as much as we can in terms of cooperation. And as I said to my colleagues here in Africa, more and more of our eyes are turning towards India as an example to the developing world how to tackle important issues. So I want to say the other monitoring and predicting when an oral cancer becomes an oral cancer. The one thing I already put it in writing is that we still have no idea how long it takes for an oral cancer to develop. Does it take minutes, hours, years? What does it take for one cell to become malignant and to divide, and it and its cohort will decide to invade? We have no idea. We have no idea about when this has happened, how quickly it happens. We know about certain oral potential malignant diseases that sit there for years, do nothing. And at the same time, a cancer can pop up in an area in the same patient, but somewhere else in the mouth. And we have no idea. We have no idea about what really triggers it to become invasive. And that's one of the big questions that I have, is that how are we going to solve and how are we going to predict when something really is becoming dangerous for the patient?
Yes. That is a question that remains. And thank you so much. And thank you for joining, although you're traveling. And so I think I will just wrap up. Anyone else, Dr. Anupama?
I think that has already been a wonderful discourse. And So grateful to each one of you for the participation, for highlighting such vital aspects, very good take-home points for all of us.
Yes. Geronimo, you wanted to say something? No. Okay,
No,
cool.
I'm good.
Okay. So I think this evening has given us some very interesting points, which are my observations, and I may not be right, but these are my observations. One is oral cancer weighs very heavily on us dental professionals and on the one pathologist who was with us. Yes. It seems to totally occupy our mind for the most part. And that is mainly because, not so much because I think that the other oral and maxillofacial conditions are not important. They are. And you think about the size of the problem of something as simple as dental caries, which I'm saying simple, but it's not simple. I know that. So while it is very much on our mind, and from our discussions, we can summarize that we still do not have the answers. The ones that we do know, or what we do know, we still have not totally managed to inform the public about. So even the bit that we know, the public does not necessarily know and understand. So we need to get that across out better in a language and in a way that they can understand and relate to. And the part that we don't know, we definitely need to keep finding out. Another thing I think was the concept of not just the physical part of the disease, of oral cancer specifically, but the psychological part, which I think very often is ignored, and it's a very big deal. Facing something that can be potentially fatal has many more levels of effect than we can summarize or understand by just treating the physical entity. It's just not possible. So we need to understand that and be aware of that. But another very interesting thing that we noticed is, while we are so taken up by oral cancer, we had my friend who spoke to us, to dentists, and she did not have any worries about oral cancer. Her worry was about patients, doctors not really checking beyond what you have gone for. So there's a small cavity, you just ignore it in that visit, and then it becomes a big cavity the next time. So that was what is on a patient's mind. And Mr. Richard, who was with us, also asked us about something very technology, and where technology is going, AI. And I understand because he does work in that. So I think there is an imbalance in what we find important and what the populace finds important. So either we need to make them see the importance of oral cancer, but whether we want to really terrify the bejesus out of everybody by making everyone think only of oral cancer, I don't really know. But it's an interesting discussion, and I think it's a conversation we should continue on another day in terms of okay, we want to talk to the public, we want to reach the public, but what exactly do we want to tell the public? That may be a good thing to decide before we keep going on and on.
Right.
Yes. So with that, I am signing off and I hand over to Dr. Anupama.
Thank you. Thank you, Dr. Mandana. I just want to conclude today's program by once again thanking Dr. Daftari for being present with us for this momentous occasion. Dr. Hazare, for all his wishes, we know that he's sent us his best. He was briefly there with us on this meeting. Dr. Chug, for gracing the inaugural, for actually getting the channel live. Hearty congratulations to all the participants of the open mic faculty contest. Gratitude to our judges, Mr. Alric Gomes, who is tuned in, by the way, so contestants, don't be disheartened. And also Dr. Sanket Sharad Kumar for lending their time. And finally, definitely not the least, on behalf of the entire team of Oral Pathology 360, I would like to thank each and every one of you, our guests, everyone who is with us here on Zoom, on the YouTube channel, I'm very grateful for your active participation. We can see there's a flood of messages. There's a lot of appreciation for all our talks, all the presenters. You all have done beautifully well. And I'm very grateful that each one of you has made time to be with us and contribute to all the sessions that we've had today. So it's been a landmark inaugural of the Oral Health 360. I also want to thank Dr. Mandana for giving me this opportunity to be a part of this wonderful initiative and wishing each one of you a great evening ahead. Remember to subscribe, press that bell icon, and that's how you can get all the latest on Oral Health 360. Thanks. Thank you so much.
Thank you, everyone. And we are signing off, but let me also tell you, as you might have noticed already, is that Dr. Anupama is the latest addition to Team Oral Pathology 360.
Thank you.
Yes, she is very much a part of the team now. And of course, there are friends who, even if they are not, they are still a part of the team, whether directly or indirectly, like Hieronima, like Professor Joss. Puyan was there earlier. So these people are always there, always a part of what we do. And thank you all so much, every single one of you, whether you were in the audience, whether you were participating, or whether you are here today or you're going to watch this later. I thank all of you. And none of this would have been possible without you. Thank you so much.
Thank you. Bye-bye.
Thank you. Bye, Sanket. Bye, everybody. Bye.